Can you diagnose migraines without imaging tests? Have you ever wondered if you can diagnose migraines without needing those fancy imaging tests like computed tomography scans or magnetic resonance imaging? Well, let's break it down. The good news is that diagnosing migraines can often be done without these tests. Instead, healthcare professionals, especially neurologists, relying on a detailed medical history and a thorough examination. When you visit a doctor for headaches, they will ask you a lot of questions. They want to know about your headache characteristics. This includes how often you get headaches, how long they last, where the pain is located, how intense it feels, and what type of pain it is. They will also ask about any other symptoms you experience. This might include visual disturbances known as auras, sensitivity to light, sensitivity to sound, nausea, or vomiting. Family history plays a role too. Migraines often run in families, so knowing if anyone in your family has them can help the doctor make a diagnosis. During your visit, the doctor will perform physical and neurological exams. These exams help rule out other causes of headaches that might feel similar to migraines. For example, they want to make sure you do not have an infection or a neurological disorder that could be causing your headaches. If everything checks out and your symptoms fit the typical migraine pattern, imaging tests are usually not needed. Routine imaging is not recommended for most migraine cases. This is because imaging often does not change the diagnosis or treatment plan. Sometimes, imaging can show findings that are unrelated to your headaches, which might just cause unnecessary worry. However, there are situations where imaging might be necessary. If you have unusual symptoms, sudden changes in your headache patterns, or signs that suggest another underlying condition, your doctor may recommend imaging tests. These red flags could include neurological deficits or sudden severe headaches. To help your doctor make an accurate diagnosis, keeping a headache diary can be very helpful. This diary should include details about the timing of your headaches, any triggers you notice, your symptoms, and how you respond to treatments. So, in the context of headaches and migraines, the diagnosis is primarily clinical. It relies on understanding your symptoms and conducting examinations rather than on imaging tests, which are reserved for more complicated cases.